So, about the mechanism of action of NSAIDs, these class of drugs. First, let's talk about some introductions about this class of drugs. NSAIDs stands for non-steroidal anti-inflammatory drugs. It means we have chemically non-steroidal backbone of drugs. It means we have a non-steroidal structure drug that can inhibit the inflammation, can suppress the inflammation, some part of the inflammation cascade. Secondly, it is why NSAIDs, because we want to inhibit the inflammation. So why NSAIDs? Because we want to inhibit the inflammation process. Why inhibition of the inflammation process? Because we want to inhibit or prevent the consequences of inflammation. What is the consequences? What are the consequences of the inflammation? Fever, pain, some hypersensitivity reactions, and so on. NSAIDs are chemically heterogeneous molecules. It means they are different in their structures, base of the structures, but the same mechanism. Although they have heterogeneous, different chemical structures, but they have same mechanism. And what is the mechanism? The inhibition of inflammation. How? The inhibition of the inflammation by inhibiting some enzymes in the process of inflammation. What enzymes? COX enzymes, and we will talk about soon later. There are at least 3 recognized COX isoforms, with the inhibition of COX-1 and COX-2 being clinically relevant. Most NSAIDs are non-selective in inhibiting varying degrees of COX-1 and COX-2 enzyme. However, many newer NSAIDs predominantly inhibit COX-2, and they are called COX-2 inhibitors, selective COX-2 inhibitors. The only commercially available COX-2 inhibitor is celecoxib. So the main idea, what is the mechanism? First, let's talk about the enzymes that we want to inhibit them in this process, so we can inhibit the inflammation, COX-1, COX-2, and other isoforms. These kind of enzymes, when your body is under some conditions like oxidative stress, like injury, some types of injury, ischemia, lack of oxygen or reduction of oxygen, the seizures conditions, the neurodegenerative diseases. When your body is under these conditions, these enzymes, the COX enzyme, the cyclooxygenase enzyme, can transcript and translation under these conditions. So after these conditions that your body is under them, the transcription and translation become accurate, and the enzymes of COX will produced. So now you have these enzymes, COX-2, COX-1, and other isoforms in the cell membrane, and your body is under some conditions, some stressful conditions. So under these conditions, the COX enzymes will affect on some molecules, that the important one is this molecule called arachidonic acid. These enzymes, COX, will affect on the arachidonic acid and turn the arachidonic acid to some other very important molecules called prostaglandins. These prostaglandins molecules, we will talk about them later in other videos. These are very important molecules. They have a bunch of rules in the body, so they are very important. But in this case that we are discussing about, the prostaglandins can cause fever to us, can cause pain, can cause some inflammation reactions. So by inhibiting the synthesis of prostaglandin by COX enzymes, we can hopefully inhibit the fever, the pain, and other things. And here is another concept, that's why we were looking for finding some drugs that inhibit selectively. For example, COX researchers show that the COX-1 enzyme, for example, has a rule in the stomach and the barrier of the stomach against the acid. So if we don't inhibit COX-1, we can hopefully expect that the barrier of the stomach, there is no damage to this barrier, because when we inhibit both COX-1 and COX-2 and non-selectively, one of the consequences or adverse effects that we will discuss in other videos, some of the adverse effects are on the stomach and GI upset. And they are very important because they can cause some bleeding, GI bleeding in the stomach and other part of GI. So if we inhibit selectively COX-2, and the importance of the COX-2 in the inflammation process and the synthesis of these prostaglandins is very important, can potentially inhibit the inflammation process and the fever and the pain and other things, and at the same time, by non-inhibiting the COX-1, we can protect GI bleeding. But here's the thing, in the clinical, not completely we can inhibit the GI problems of the NSAIDs, but we can reduce that and use the COX-2 selective inhibitors like celecoxib in the patients that have a background of GI problems and we want to use NSAID for their pain, for their fever and other conditions. Another important thing that I want to consider and I want to mention it is that about COX-2 enzyme. And when we inhibit the COX-2 enzyme selectively or non-selectively, both of them, the COX-2, by the researchers, show that these enzyme COX-2 has a role in the cardiovascular protection. And when we inhibit COX-2 enzyme, we can unfortunately expect that there may be some cardiovascular problem with the patient by using these COX-2 inhibitors. But the fact is that this is until now a theoretical sentence, and in the clinic, in the recent researchers, the COX-2 inhibitors maybe not have this bad effect in the cardiovascular systems. But as a caution, the selective COX-2 inhibitors relatively not considered in the cardiovascular patient, and the non-selective inhibitors of COX-1 and COX-2 inhibitors as a caution, not considered in the patient with GI background problems.